after surgery, we're going to have you do something called passive range of motion exercises. There are some procedures where we start those exercises a little bit later because they are a series of flexion and extension exercises. So you're going to be bending and straightening the joints of the leg that had surgery. And you know, most often, again, we start that 6 days after surgery, but please refer to your discharge instructions form in terms of when that is going to start for your pet, because some pets it does start a little bit later. And we do have another video that demonstrates the passive range of motion exercises. So please, you know, look at that to see how to perform them the correct way. We'll also discuss that in terms of your discharge when you come in. But just the passive range of motion exercises, we want to do about 2 to 4 times a day until the pet is using the leg normally, is kind of the school of thought there. And it just helps keep the joints limber so that we're not losing some of that movement because they're not doing as much activity, or because after surgery they're not going to be using the leg normally. So that can affect, you know, some stiffness and things that can occur. So please follow the information in both the passive range of motion handout and then watching the video on that as well. So if we're going to do our range of motion on the back leg, again, we're going to work the 3 joints of the leg, the ankle, which is also known as the hock, the knee, also known as the stifle, and the hip. And you are being a stinker. I know I've asked you to do a lot of things today, haven't I? Yes, you've been a very good girl. And I promise there's lots of treats when we're done. Okay, just a few minutes more. All right, can you lay down? Thank you, baby girl. Good job. All right. So when we work these joints, again, we're going to do the flexion extension, so the straightening and the bending. And when we do the ankle, you're basically going to move the foot backwards. If your dog doesn't like having their feet touched, just go above it. And then you're just going to bring this part backwards. I usually put my fingers on the back of the point of my ankle. And then flexion, we're going to bend it up towards the knee. And then extension back down. Flexion back up towards the knee. And she's fighting me. And we're just going to go as far as she'll let me, because we don't want to force things. When we do the knee extension, I always will put my hand on the knee itself. And I usually grab the ankle region. And straightening is we're just going to bring, I know, we're going to almost be done. I promise. Yes, you're doing a good job. You're going to bring the lower leg forward. And then flexion is we're going to go the other direction and bring the ankle up towards, what am I doing under there, huh? We're going to bring the ankle up towards her rump area. And then extension back to straight. And then flexion back up. And then straighten, yep. And then back up. Once they get the hang of it, they really tolerate things pretty well. It's just very strange to begin with. And then lastly, we're going to do the hip. Hip extension is going to be the other half of the Superman. We are going to extend backwards and then bring the leg up in flexion. So the knee comes up and touches the chest area. Extend and flex. There we go. That's really good. One final thing we'll have you do when we're doing our range of motion exercises is it's great to work each joint as its own individual working unit, but when we're walking, we don't just move one part of our leg at a time. So we also have you do something called the bicycle kick, or if we're doing it in the front, sometimes it's called like the swim. But basically, we want to move the leg to simulate that they're walking. And Ray, I'm going to have you lay down for this one, okay? This is our last little bit of stuff. And so basically you're going to hang on to the foot area and you're going to move their leg like they're riding a bike. And so we're going to flex and extend all sorts of things simultaneously. And when you do this one, you want to do 12 revolutions versus just 12 repetitions when you're doing your range of motion.